A dire financial situation is leading to worries. Hennepin Healthcare will have to close. In a grim letter to its employees, hospital leadership both highlighted their standing while asking for ideas on how to save money, adding they have to cut at least $50 million in coming months. Ben Henry spoke to county leadership about what they're calling a crisis, and it sounds like it, Ben.
It does. This letter paints a tough road ahead, talking about reducing costs and right-sizing immediately, adding everything is on the table to figure out how to cut tens of millions of dollars in a matter of months and more following that.
I imagine the letter sent to employees recently was a tough one to send out.
Yep. Yeah, I think it's one of those tough but necessary.
This is that letter addressed to valued employees. Hospital leadership outlines a dire fiscal position, saying they're in crisis mode and they need to find at least $50 million in savings in just a few months.
Our fight has been since we took direct control was, keep the hospital open.
Hennepin County Commissioner Jeff Lundy also chairs the board overseeing Hennepin Healthcare.
How do you reach that?
But we want to be a scalpel, not an axe. What we're talking about is where can we do things differently? Where can we do things more efficiently? Where can we partner with other hospitals?
How many cuts do you expect here moving forward?
I don't have that offhand. I think one of the commitments we made to staff when we took over direct control was that they would be the first to know things.
In 2024, there were nearly 95,000 emergency department visits at HCMC. They welcome any patient, no matter their ability to pay or where they live.
40% of the patients who arrive at the trauma center, the burn, the trauma, the ECMO, pediatric, renal, they are not Hennepin County people. But 100% of the property taxes that go to cover the costs are Hennepin County.
As for how they got to this point, Lundy points to pandemic dollars ending and a big expected drop in federal support. The letter saying, leadership owns responsibility for not acting prudently and with a changed focus in the past, adding, that stops now.
How about a message for workers worried about losing their job?
Yeah, I think, in this time, some of these changes are going to be impactful and they're going to hurt. But, oftentimes in this kind of situation, if we don't make these changes, we may not have a hospital.
The letter goes so far as to ask employees to share cost-saving ideas, stop essential work, and for team leaders to plan for 5 to 10% reductions. Commissioner Lundy also said they plan to ask the legislature to change how the sales tax revenue at Target Field is used, hoping they can get some of that to help. It'll be a tough road ahead, Lindsay.
Yeah, and it affects so many people.